Now, this idea of calling this socialism, that is nothing more than a big lie. It's a fiction that's been told to us by none other than the insurance companies. They have promoted this for years. And if you say something over and over and over again, you're going to believe it. Well, don't believe it, because it's not true. This is capitalism. Capitalism, as I said, the same capitalism that Walmart and IBM and Best Buy and Home Depot and all of the big companies practice for 100 years now. They cut out that expensive middleman who is not necessary. And the health insurance companies aren't necessary. They don't do anything but raise the cost for you and cut the benefits. I think I've covered some of the big things here. There's a few other small items in there, like 0.25% on stock transactions in the stock market. That'll raise about 50 or 60 billion dollars, oddly enough. It's a lot of money. But overall, this plan, HR 676, Medicare for All, will save money over what we are paying now. It will save, I think it's about 50 or 60 billion dollars. I think it's a little more than that. The economists have proven this out. They've vetted this thing, and they know that our overall costs will go down. You will get better benefits than any system that we have now, and you will pay far less for it now. And it can be done. Now, why isn't it done? It's that congressman of yours, that senator of yours that has to be converted over to doing something for you. That's what got me so angry. We've had an election here, and they're scurrying around. You know, the Republicans lost a bunch of seats, and the Democrats gained a bunch of seats. But there's Democrats in there that aren't convinced that this is the way to go either. They either don't believe, or they fear the health insurance companies and the pharmaceutical companies. There's nothing to fear there for them except us, the voters, because we're the ones they should be pleasing. Now, here's how to get it done. It's pretty simple. First, I'm going to hold up this telephone number. 1-866-338-1015. That's a free call. When you call that number, a lady's going to answer, and she's going to ask who do you want to talk to, and you are going to tell her the name of your congressperson. And she's going to immediately shift you over to that office. You're going to get a staff member. You won't get the congressperson. You're going to get a staff member, and he or she is going to listen to your story. And this is what you're going to tell them. You're going to tell them HR 676 is some legislation, a national health care plan, Medicare for All, is what I want. I need it. My family needs it. My country needs it. And I want you to co-sponsor it. I want you to pass it. Remember, you're a voter. You're the boss. He's your employee, and he knows it. Every election, he knows it. And when you say, I'm a serious voter, he knows what that means to him. He means that he's going to have to earn your vote to get reelected. Let me tell you how this works. When a congressman hears from one person, he probably thinks that there's anywhere from 100 to 500 people out there that are thinking the same thing. If he hears from 500 people, that's tens of thousands of people out there that he knows want this particular bill passed, are concerned about it. He's going to listen, and he's going to vote for that bill. It's almost a guarantee. Bills have been passed like this, and they will be passed like this in the future, and that's one of the big ways that this bill will be passed the same way. You got to call your senator. The bill isn't in the Senate. We've got a new Senate in there, and we've got to stiffen their backbone and get them to take care of us. It's up to you. So I might say that when you call and ask for your senator, in Missouri it's Bond and McCaskill. You have two senators in every state. and you'll find out who your congressperson is. If you haven't found out by the last election, call up to your library. They'll tell you who your congressman is by your address and zip code. They know how to do it. Or your Board of Election Commissioners, or your League of Women Voters. They're in the telephone book, and they'll tell you who your congressman is by the questions they ask you. That is how to get it done. Now, if you want to work with a national organization, there is a national organization that has been working on, they have about 60,000 members so far, and it's just relatively new, a few years old. That's amazing how fast they've grown. That's how big the issue is. They're in almost every state of the union. Here is who they are. This is their website, healthcare-now.org. Healthcare-now.org. You can become a member. You don't have to give a donation. It'll always help, of course, but these are the people that are supporting and pushing with many organizations, unions and churches, consumer groups, all over the nation, and many, many, many people like yourself to get this passed. If you want a little help right here in Missouri, we're just a subsidiary of the same organization, Healthcare Now Missouri, part of the national organization supporting this bill. You can call me at this, you can email me at this email, robert.recht@sbcglobal.net. robert.recht@sbcglobal.net. There's not much more to it than that. Congressmen who hear from thousands of people on one issue are going to sit up and take notice. They're going to vote on that law. If you want this law, and it's really the only law that's really available that will give you such benefits, better than a congressman himself, at a price you can afford because it's based on your income, a sliding scale. And it's well financed. It's not going to raise our taxes. Not going to raise our taxes like all these other bills that are going to be proposed almost immediately the minute Obama comes on board. And one thing, we're lucky. Obama himself in the past has said, this is called a single payer bill without insurance companies, where it goes through Uncle Sam, through the private hospital, the private doctors. That's why it's not socialism. He said this is really the best way to go. He would sign the legislation if it were brought to his desk. But the condition is that we have to, from the bottom up, the legislatures, their hands are tied because the lobbyists are after them, the health insurance companies are after them, which is much money and power and pressure as they can bring forth. It's up to us. He said he would sign a bill, and every congressman will do the same thing, Republican and Democrat. This is not a conservative or liberal issue, remember that, or a Republican or Democrat issue. It's a people issue. It's one of the most important things to all Americans right now. So there's your answer right now. We can have this if we really want it. It's up to you. That's your job. Get on the phone, call your congressman, call your senator, call them as often as you want. The more the better. Get your friends to call, you know the story. Get your friends, put it out in your email, to your list on your email, your contact list. Tell people about it. Believe me, 9 out of 10 want this thing passed. That's about all there is. Thank you very much for your time, and good luck to both of us.